We really can't talk about the inequities that we see without calling out structural racism as a root cause. Lift off. Black and Latino people make up a very large proportion of quote-unquote essential workers. So workers who are in the food services industry, transportation, healthcare, on the front lines, healthcare workers, a lot of the cleaning staff, childcare, all of those jobs we tend to do. And those high contact jobs increase our risk of exposure. And the reason those are the jobs that primarily Black and Latino people have isn't because that's just what happens. When we think about access to care, we have higher rates of uninsurance, or if we do have insurance, the quality of care that we're receiving may not be to the level that it should be. And then also, again, the chronic stress of racism predisposes us to worse outcomes from COVID-19. Redlining facilitated the concentration of segregation and obviously the concentration of poverty in Black communities. Just having all of that in one location and having folks, unable to access healthcare. We've seen in numerous studies that health-related concerns that Black people may have, Black women specifically, are not taken seriously. And I think we've seen this with Serena Williams when she talked about, I think of the pulmonary embolisms that she's had. So even Black women from a very high social economic status still experience the same biases. Provider bias, that's one issue. The other issues are related to, access to care, obviously, access to high quality care, often in communities that are disproportionately impacted. Black communities, the quality of care can be very different from in other more white or affluent communities. This morning was reading an article about a young Black woman who died from COVID-19. She went to the ER to get care and was initially turned away. She returned again, but then was concerned that if she didn't have COVID-19, she would acquire the virus while she was in the ER. So she went home, and then 24 hours later, she was on a ventilator, and she eventually died. Telehealth has been something that I think has definitely been accelerated as a result of the pandemic. And this really has the potential to increase access to many, many people. For my bureau, we receive funds from the federal government and from the city government to support agencies in providing HIV prevention and treatment services. And so we worked with these agencies in terms of how they can pivot their services to telehealth, which has been really exciting. And then we had a community home test giveaway where we worked with some community-based organizations to distribute home HIV tests. All that to say is now we've made everything virtual. It would be wonderful to think about how can we create a safety net for all Americans, particularly the most vulnerable Americans, like we see in other countries where someone loses their job, they have the support that they need to continue on. It doesn't devastate their lives. And I think obviously making sure that our essential workers are, paid a wage that reflects the fact that they are essential, right? Always, and not just in a time of crisis.